we think of viruses like COVID-19, RSV, or the flu, we might think it can only affect our lungs. But specialists are saying respiratory viruses can also have an impact on our heart health as well.
The way I think about the mutual jobs of the heart and the lungs are to pump and to oxygenate the blood. The heart and the lungs are right next door, physically touching one another, and it's really that interrelatedness that is why we not uncommonly see manifestations of the same illness in both organs.
Respiratory disease can have a bigger impact on your heart health than you may realize.
Personally, I have so many patients come to me with palpitations, with increasing heart rate, and this is something sometimes needs intervention, sometimes just goes away on its own. We did see some cases that the heart become inflamed after the infection. Sometimes we call it myocarditis.
Even RSV, a respiratory disease most commonly found in children, can impact the heart.
Certainly any child that has an underlying heart problem, like a problem that they've had since birth or a congenital heart problem, getting any sort of viral illness can have really serious effects for the heart in addition to the lungs.
But it's not uncommon for patients with COVID-19, pneumonia, or the flu to experience side effects on their heart.
The main COVID-related heart concerns happen predominantly in adults with risk factors for both more severe COVID infections and risk factors for underlying heart disease.
Patients get very sick and their heart become weaker. This is a phenomena that we know, so this is not considered to be new for COVID per se. And if you look at influenza and other viruses, it's basically done the same thing.
Some people infected with COVID-19 can experience long-term effects, commonly known as long COVID.
Patients whose ease of breathing or overall energy levels never really return to what they would consider normal following a COVID infection can look really, really similar to someone who maybe has an underlying heart problem.
Bringing doctors from different disciplines to work together on various treatments gives patients the best care possible.
In 2023, because the need for ECMO with our various waves of major respiratory illnesses that we've seen in the last 20 years,
ECMO therapy may be used to treat patients with severe complications with their heart and lungs by pumping a patient's blood outside of the body, allowing their heart and lungs to rest. ECMO therapy requires a specialized team to perform it.
And we're really lucky here in Community System to have really skilled interventional pulmonologists and sometimes also cardiologists or critical care doctors who are also skilled in starting and managing ECMO.
And while this type of treatment may not be needed for every patient, doctors say there are things everyone can do to keep themselves healthy every day.
We really can make a difference for the health of our community by continuing to be very diligent, masking up, washing our hands, and maintaining a good safe distance when we're in crowded spaces.